for joining us this evening for a very important topic on men's health. So the title of this presentation is Understanding and Treating Urinary Problems in the Enlarged Prostate. But we're going to make it much broader than that and touch on some other topics and welcome questions from everyone who's joining us this evening at the end. So let me jump to the next slide, and then I'm going to introduce myself. So my name's Dr. Stephen Kappa. I'm a physician here at the Urology Group. I also have an administrative role with our practice as vice president. I did my medical training in Nashville, Tennessee, where I also did residency, medical school, and business school, and did my undergraduate studies at Yale. I'm originally from East Tennessee, but moved here with my family. We now have 3 kids and really enjoy the community here. And I'm really proud to be a part of this practice. So a couple of specialties there, but I'm going to key in on one of my favorite problems to treat because it really has a tremendous quality of life benefit for patients, and that's the enlarged prostate. So I'll jump to the next slide and we're going to get started. Before we talk about the prostate, though, I want to take a step back. Men's Health 101. This book is really influential in my thinking and approach to patient care. So it's written by Dr. Peter Attia. It's called Outlive. And in this book, he introduces some very simple but important concepts about lifespan and health span and some key tenets of maintaining your overall health and extending your health span. So let's define some terms. So first, lifespan is how long you live. Okay, that's pretty simple. Your chronological age until you die. Health span is how long you live with a good quality of life, with healthy enough bones, muscles, and joints to go on a hike in older age or to play with your grandkids, to do activities you love. And so I think a lot about the problem of the prostate and urinary health and maintaining your health, your bladder health, so you can do activities. You can go to a football game. You can, again, play a sport and not worry about where the bathroom is at all times. It's obviously very disruptive to your health. Now, another important point here you can see on the left is this isn't just about the prostate. We're going to talk a lot about medications and lifestyle modifications and surgeries for the prostate specifically, but your overall health is so critical for your bladder and prostate health. And what are the key tenets? And I talk about this a lot because they do relate directly to some urinary symptoms. The quality of your sleep, exercise, particularly strength training. We have some props here. So I want to just put this in your mind that strength training in older age is so critically important. It's not directly relevant to the bladder and to the prostate, but you're not going to be able to enjoy any activities without exercising both strength training and cardiovascular fitness in your older age. Nutrition is key. What you eat, what you drink, we'll talk more about that later. Your emotional health, please don't ignore that. It affects your physical health and avoiding the bad stuff. I can give you medicines for your prostate and do a surgery on your prostate, but if you're smoking, if you're drinking excessive alcohol, it's not going to help you. So these are key tenets. Again, we'll kind of come back to these as we go through the presentation, but I want you to think throughout this presentation about your overall health, not just your prostate health. So we're going to jump to the next slide. And this is a poll, so this should pop up. Okay, this is just a question. We've jumped right in. BPH. So we'll let you guys click on what you think the answer is. This is what we're talking about tonight. So we have some answers coming in. I'll give you guys some time. Been peeing heavily, bathroom privilege, hyperactivity, benign prostatic hyperplasia, all of the above. So the audience, pretty much everyone's participating. So thank you for doing that and jumping right in. But the answer to this poll is BPH is benign prostatic hyperplasia. So most of you guys got this right. This is extremely common. 43 million men in the United States suffer from this condition. A couple of things to note. This is not cancer, so it's benign, not a malignant cancer. But one thing that we do when we approach patients who have these urinary symptoms is always screen for prostate cancer, another topic I'm very, very passionate about. We'll talk more about that during later slides, but this is very treatable, okay? It's very common, it's very treatable. And so when you have some of the symptoms that we're going to be discussing, please don't ignore them because we can help extend your health span and your urinary health by treating these conditions early. So let's jump into anatomy. We define the term BPH. This is your bladder and your prostate and your urethra. So one of the first classes you take in medical school is gross anatomy. And so you do head to toe. And so this is kind of where we start, is understanding how our body works. And this is a bladder. The bladder is very obvious to all of us. We fill our bladder with urine and we empty our bladder with urine multiple times during the day and sometimes at night. It is waste product from the kidneys, drains down. And you can see right here, the prostate gland has both sexual and urinary functions, and it encircles the urethra. So the urethra is right there on the slide, the tube that carries urine out. And one of the things you can see as you go to the right picture here is as the prostate gets larger, which it does for many men as they age, it can obstruct the outflow. Bladder outlet obstruction is what we call that. And that can be from an enlarged prostate and other conditions. So there's some anatomy, but how does this present to me? Patients don't usually come in and say, I have a big prostate. Very few people know that. What they say is, I have severe urgency. I gotta go, running to the bathroom. Difficulty starting my flow, hesitancy, interrupted stream, frequency of urination. I'm going every 30 minutes, every hour. It's very disruptive. Also at night. There's a variety of other symptoms, and we're going to take actually the formal symptom score quiz or a questionnaire that we give patients in our office every day, and you can score yourself. But these are the common symptoms that men will come in and discuss with me. Now, all those symptoms, any of those symptoms, particularly if they're bothersome, get checked by our doctors. You can start with your primary care physician. You can come and see us, because if you don't and you have a delayed treatment, you can have some very serious consequences. So these include urinary tract infections. You're probably all familiar with those. They can be very sick, and you can end up in the hospital with those. Bladder stones, everybody's heard about kidney stones. Bladder stones can also form from not emptying your bladder well. An important one is damage to the kidneys. Now, it takes a lot to get to that point, years of ignoring symptoms, but we see that every day. Leakage of urine, and then one thing that's very difficult is damage to the bladder that requires a catheter, which is a tube in your penis. It's very, very, very difficult to manage that, and some men require that long term. So the whole purpose of this talk and of how we counsel men is to prevent these complications of BPH from happening. One thing about cancer risk, it doesn't mean you have an increased risk of cancer, but we always do alongside with these symptom evaluations and treatment of BPH, a prostate cancer screening test, which we'll talk about in a second. So this is just a little break from all the information we're sharing. I love this card. I give it to people all the time. But urology, please hold. Let's go to another poll. So we're going to jump in to this. So you should see this pop up in a second. Here we go. Would you rather have a cystoscopy, play PGA champ Scott Scheffler in a televised event? So if you don't know what a cystoscopy is, you may change your mind. We're going to go over that, but we'll let you guys answer this question. So thank you for participating. Everybody wants to play golf. Maybe they're not worried about getting beaten. But let's talk about what we do, including a cystoscopy, to evaluate BPH. So a couple things. First is the dreaded digital rectal exam. I'm joking about that. It's really not that big of a deal, but we do this all the time in our office. And what this is it's a rectal exam. We feel the prostate. We're examining also for nodules that can be concerning for prostate cancer. But this is very helpful to me because I can tell a guy right there in office based on a really quick physical exam how big his prostate is, an estimate of the size and of the prostate, and whether or not we need to do further studies. So PSA, I mentioned prostate cancer screening. This is really important. We always do this as part of our evaluation. So you get a blood test, a urine test. We're looking for infection, also looking for blood, which can come from the prostate or from a urinary tract infection. And a bladder scan, I did my first cheesy prop. So we got another one. This one's actually something we do every day. This is a bladder scan. So I'm going to turn this on. Hopefully this works. Yes. Okay. So this is a bladder scan. I want to show you one of the things that you'll likely receive if you get an evaluation from us. This is an ultrasound probe. Doesn't hurt at all. You put a little jelly on the lower belly. I'm actually going to try to do this for me so you can see. And you can see that my bladder is actually empty, 0 cc's. So we do this bladder scan. It's a simple, non-invasive ultrasound test to find out how much urine you hold. So our patients will come to the office, they void, we do the bladder scan because they may say, hey, doc, my bladder's empty. And I say, well, I want to prove that because you've got some urinary symptoms that I'm concerned about. And a lot of times they'll be wrong. They'll say, actually, we have 100, 200, 300 milliliters of urine still in your bladder. And that will likely lead us to further evaluation. So further evaluation, what is that? So 2 tests that we do that assess the pressure and the flow of the bladder. So urodynamics is a advanced testing that we do in a lot of patients, particularly those with neurologic conditions, that is really the gold standard, but it's a little more invasive. It involves a catheter. The UroCuff test is something that I really like doing and offering my patients because it will tell me whether or not you're obstructed based on your pressure flow pattern. So it's a non-invasive test that you can actually see it there. You pee in this funnel device right in our office, come in with a comfortably full bladder, and we also measure your residual with that ultrasound I just did. But what I'm looking at is your stream, your flow rate, and then also your pressure, which we can measure with this machine, your intravesical or your bladder pressure. It comes off in this report, which we share with patients, and it'll again lead us to more testing or really pushing medical or surgical treatment, offering that to our patients if there's a very, very high pressure bladder that is at risk for that patient. So the next thing, so we talked about cystoscopy. Would you rather golf against a pro or do this test? You may change your mind from that previous poll because this is what the cystoscopy is. Now, let me reassure you too, again, like the rectal exam, this is really not that big of a deal. This is a scope test. It does not involve any cutting. You can see here anatomically, goes through the penis into the bladder. What we're doing with this exam is we're looking for the size and shape of the prostate, also the urethra and the bladder health. It's extremely informative. Now, there are a couple of options. So you can do this test awake. We have a lot of patients who do that. We use a numbing jelly for that. And some patients can actually even watch the results on a screen. But if you're worried at all about this, as we talk to patients, I have some patients really concerned, worried about the discomfort. We can offer patients also an anesthetic, a light anesthetic for this procedure. So this is something that we do all the time. And again, it leads us to the question of what's the best treatment for you. So a couple other things, which we won't go through. Prostate ultrasounds, we do that a lot as well to get some more anatomic information. And then biopsies for patients who are concerned about prostate cancer. Again, another important topic. We do that as part of our screening when we're evaluating urinary symptoms. So another poll, let's see, it'll pop up here in a second. So which of these, we're going to talk more about this, would be hardest for you to cut or give up or cut back on? So we have some good ones: coffee, tea, carbonated drink, alcohol, citrus drinks, spicy foods, chocolate. And we'll kind of let you guys answer this. For me personally, I think it would be coffee. I'm a big coffee drinker, so I love that. But yeah, I think people agree with me here. This is by far 73% of you guys don't want to give up your coffee. I don't blame you. Okay, so let's jump to the next. So let's talk about treatments. Let's jump right in. This is what you're wondering. Hey, a lot of these symptoms that you mentioned, I'm experiencing. I'm eager to take this survey at the end, but I want to know what I can do. Especially if I showed up to this webinar and I'm having really a lot of difficulty from a quality of life standpoint. So there are 4 kind of categories. The way I think of this is lifestyle changes. That's limiting the things we just surveyed you on, the excessive amounts of alcohol, the caffeinated beverages. These things can irritate the bladder. There's some voiding techniques we'll talk about as well. Medications. So it may not be an addition of a medication, but avoiding some that can affect the bladder. We'll talk about those. Taking medicines, we give medicines all the time. Some are very effective to help men with their urinary symptoms, and then surgery. So we'll talk about procedures at the end. So lifestyle changes. Again, I want to go back to that first slide, thinking about the quality of our sleep. This is really important. Exercise, nutrition, these emotional health, these things affect the bladder too. But some basic things that are really easy to do and that can make a big difference in your health. So relaxation when you void, not straining, taking your time. And another thing, I talk about this with lifestyle. So I have my nurses, my teachers, my truck drivers. I have patients who come in with professions where they're, they don't have a lot of opportunity to go to the bathroom. And what I say to them is, I understand a busy life and a busy job, but I cannot emphasize to you enough how important it is. So when you need to go to the bathroom, take your time, go use the bathroom. It's part of life. Everybody does it. So really take time to relax and try to empty your bladder as best you can. Avoiding liquids after dinner. So this is another thing. At night, a lot of men will consume a lot of liquids after dinner and then wake up, 10 o'clock, 12 o'clock, 2 a.m. And this becomes a pattern. So it doesn't mean dehydrate yourself, but avoiding excessive amounts of liquids after dinner can be a useful strategy for men who pee a lot at night. We mentioned these things. I don't need to go over these again. There's some bladder irritants, and I tell patients, some of these are fine. Again, I enjoy my cup of coffee in the morning. But a lot of this is trial and error. you can see what triggers you have for your bladder symptoms. Now, sometimes you can do all this perfectly. Again, going back to that first slide, I'm exercising, I'm doing my strength training, I have lost a lot of weight, I'm really paying attention to my health, I'm sleeping well, I'm doing all these things, but I still have bad urinary symptoms. I'm peeing all the time during the day, I'm dribbling, I'm leaking. This is really a problem. So for patients who are there, we go to the next step. So we look at your medication list. There's some here, some even over-the-counter things like Benadryl that can affect the bladder. So we'll review this with you. These are some common ones. Again, over-the-counter meds, to help your prostate. You see these on TV, you see these at the pharmacy. I always caution men about some of these supplements is, we don't really know what's in them because these are not regulated by the FDA. Some of the herbal supplements do have some research behind them, but we have far more effective options. And so we talk with patients about that, and some may benefit from these, but be careful about over-the-counter medications and supplements that make promises that seem too good to be true. So the next thing is prescription medications. Again, I prescribe these every day, basically. There are a couple of medicines and kind of two categories of medicines that really help men with these urinary symptoms. The first is ones that relax the prostate, okay? One of the most common ones is tamsulosin or Flomax. So we give these all the time, and I tell patients too, to really be cautious about the side effects. These are extremely well tolerated, but there are side effects to these medicine. And so we were really careful in talking to you about that and give you a trial. And again, a lot of men, this is the treatment that they get, and they're really happy with it. There's also a medicine that takes a much longer period of time that can shrink the prostate. We do this in combination with that first category. It's a very helpful tool for patients. So we're gonna take a little break here. We mentioned the prostate exam reluctance. We see this all the time. But again, guys, please come in, get checked, talk to your doctor, particularly if you're suffering from your urinary symptoms. So now, again, I kind of already mentioned this, is sometimes lifestyle changes and even the medications that we prescribe don't work. So after I prescribe a medicine, I always do a telehealth call or a follow-up with the patient and say, how's it working? Are you having any side effects? And sometimes it's great. Hey, come back, see you in a year. Really happy about that. But a lot of times we're not happy. And so we don't want to ignore that problem. We want to be proactive to protect the bladder. So this is a busy slide. It's just meant to kind of show you how I think about this problem, how urologists think about this problem. This is right from our AUA, our guidelines of our main research organization. And we talk about medical treatment again. What happens? Is it being tolerated? And if it fails, what do we do? Shifting to the right. Now, there's a ton of acronyms on here. I'll go over a lot of these, but I highlight this to say that we do these the tests I showed before, the bladder scan, the ultrasound, the scope in the bladder, the Eurocuff test, to find out a couple of things is what category of treatment will be best for you. So this is what we do together. A lot of times, again, the main piece of information that I want to know is, again, have we tried less invasive options? And if we're going to surgery, what is the size and shape of the prostate and some of the other medical issues that would point me in the direction of one procedure versus another. So let's jump right into procedures. Okay, let's say that you, again, I actually, this is great. I'm getting some questions already here. I promise I'll get to those at the end. We're going to go through these pretty quickly because they may not be relevant to all the guys who've logged on tonight. But I'm going to go through these and then we'll get to somebody is asking a question about UroLift. So we'll talk about that in a second. But these are treatments that I would say kind of from a less invasive to more invasive. And we'll go through, but again, I'll tell you, caution you is that if you see something that really makes sense to you and I really would think I'd benefit from that, not all patients are eligible for all these treatments. And we'll really recommend and give you actually several options usually. Sometimes there's not one best treatment, but this is one that works for a lot of men who have slightly smaller prostates, who have not done well with medical therapy or not tolerating medical therapy, who want a less invasive option that does not typically involve a catheter. So I've done a lot of these procedures. The data is actually very good on this out to up to 5 years of treatment success. So we've done the trials on this. We've seen a lot of experience with this procedure and it works really well for men. And what I tell patients is this doesn't burn any bridges. You put you can see them here on this graph, 4 little sutures, implants, and it opens up the prostate. There's no cutting involved, very minimal bleeding and infection risk. And again, most men don't require a catheter. Now, that all sounds great, right? The other thing that I'll say is great is there's very minimal or no sexual side effects to this treatment. Downside is it doesn't improve your flow rate quite as well as some of the other treatments that are more invasive, that remove tissue, and it may not be as durable. So we have that discussion with patients, but this is a great option for men looking to get off treatment who want an outpatient treatment same day without a catheter and a pretty quick recovery. So I kind of mentioned all this. Again, it's not still easy to go through. You do have some burning, some urgency, some frequency after the procedure, but most men do very well with this. TURP. Okay, TURP, again, I'm going to go through these pretty quickly because I want to answer your all's questions, but TURP is kind of, I would say, the gold standard, one of the most common procedures that we do. This involves resection of the prostate, actual removal of tissue. A great majority of men I treat with this procedure are very happy. There are some sexual side effects, including retrograde ejaculation. The ejaculation will go backwards, higher risk of bleeding, but it's very effective, very proven. We've been doing this for many years, and patients do very well. We can do this outpatient as well, same day surgery at home, but it does require a catheter. So another treatment option that we offer, it's very effective. So this is, again, a little more information about this. Side effects, again, I kind of mentioned some of the ejaculatory dysfunction, bleeding risk, but again, very effective treatment for many men. Green light is similar. Instead of a resection loop like a TURP, it involves a laser. I really like this procedure for men who are on blood thinners. So many of the guys listening may be on a blood thinner for a cardiovascular condition. You had a previous cardiac event. So this can be a good option to minimize bleeding risk. So again, a lot of these, again, we're just going to go through very high level, very quickly. And I'll tell guys is that, once we do the evaluation, we sit down, kind of narrow down the treatments, but this just gives you an idea of all that's available to you. So let me jump to okay, hang in there. Okay, we're almost done here. Aquablation is a newer treatment that involves steam. We offer this treatment for our patients. Very effective. Again, these are all similar. And this one is more appropriate for men who have much bigger prostates, very effective for that. This shows you what that machine looks like. And then hole-up is, again, I would say in the same category of treatments that are for very large prostate. One of my partners does this, Dr. Duzing, is very good at this. And the way he describes it, which I love, is you can imagine an orange, and you take the fruit out of the orange, but you leave the peel. That's basically what's happening. So many of you may have friends or family members who've had prostate cancer and have had their entire prostate removed. It's very different. What this does is it removes the inside of the prostate, but enucleates, takes out all the tissue except for that orange peel on the outside. So it's a longer procedure, requires a hospital stay typically, although many can go home on the same day with an experienced surgeon. It does require a catheter. The data on this in terms of flow rate is very good. Durability, very good, but is a little bit longer recovery. So again, this is appropriate for many men who have large prostates. This just shows you that orange peel demonstration or description that I said about this treatment. So next, again, I'm going to kind of go back. These are kind of more invasive treatments for larger prostates. This one goes back to the less invasive category. This one is, so again, we're constantly innovating in this area of medicine because it's such a common, I mentioned 43 million men. So this is a newer treatment that involves, I would say, a temporary stent. So again, we mentioned cardiac disease a second. Some of you have cardiac stents. This is a temporary stent in the prostate. And so, as opposed to the UroLift, which leaves implants in, this has no residual implants. You leave this in for a week and then you pull it out. Now, you do have this stent in your prostate for a week, so you're going to have some urinary symptoms for that for 5 to 7 days. But we remove the device and it sort of holds open the prostate. And men have done very well who have performed this on. So another treatment option, again, we look at your anatomy, we study that with the scope test, with the ultrasound, and then we decide what the best treatment is for you. So let's go to the next slide here. We'll jump right through to prostatectomy. Okay, simple. Okay, so I mentioned prostate cancer. Again, some of you have family or friends who have who've had prostate cancer, had their whole prostate removed. This is similar to the holmium laser enucleation of the prostate, the hole-up orange peel procedure, but involves the robot making an incision through the bladder. So you kind of do the same thing from a different approach. Very good option for really big prostates. does involve, again, a little bit more invasive approach because you're doing surgery through abdominal incisions, making an incision in the bladder, but very good for men who have very large prostates and bladder stones that are associated with those very large prostates. So this is a picture. This is actually what it looks like. I do this a lot for cancer operations, for the prostate, for kidney, for bladder, but we also employ this approach for BPH. So now let me jump to another treatment. So this is actually an exciting announcement I get to share with you guys. So we have been exploring and actually already partner with local interventional radiologists on this treatment called prostatic arterial embolization, or PAE. Okay, I could talk about this a lot, and I'm going to just kind of give you the highlights, but this is something that we're beginning to offer more and more to our patients who, again, have larger prostates, have other medical issues that may not be a good candidate for some of these more invasive treatments, but has very good randomized control trial data. And what does that mean? These are research studies where we look at different approaches comparing this surgery, this approach, PAE, to TURP and other ones. And the bottom line is it works very well. It shrinks prostate by reducing blood flow. So just the way you think of this is you come into our center, our interventional radiology colleagues will be doing the procedure. It's kind of like a cardiac cath. It's a groin stick or radial artery stick, but typically through the groin, little wire down and to the prostatic arteries, and those are embolized. And it shrinks the prostate by decreasing blood flow, okay? So the procedure takes a couple of hours, usually about an hour or so for the procedure, then a recovery. There's no overnight stay, minimal risk and complications with this, minimal pain, and most patients don't require a catheter. So I actually just referred my first patient for this today, but we're really excited to offer this treatment for patients. Again, if you're interested in this particular treatment, please ask your urologist. We're offering referrals that will be beginning formally in November. We anticipate this center opening in December. And again, this may not be right for you. It's just another, you saw all those acronyms on that first surgical slide and how I work through patients. This is another one that is a guideline concordant treatment approach for certain men. And we're really excited to offer this and partner with an interventional radiologist here in Cincinnati. So let me jump to the next slide. I may have some questions about this. Okay, this is one of my partner's license plates. So I didn't get it at first, but I think this is hilarious. So no PP, see me, see your urologist. So if you have trouble with your urination, please come and see us. So we're going to shift to questions. I went through that very fast and I talk fast. I know that as well. So there was a ton of information. And what I would say is just to pause here before we do questions. Our website has great resources. The best way to learn more about this problem and to get treatment is to reach out to us, make an appointment with me or one of my partners. We'll sit down with you. We're going to get a personalized approach to you. Every patient's different. Every patient has a different story, different duration of symptoms, different medical issues that influence this. And again, emphasizing that first slide, I want to kind of end there, is that this is part of your overall health, extending your health span, your urinary health, and going back to some of the basics, your nutrition, your sleep, your exercise habits, what you put in your body, what you eat and drink. These things make a tremendous impact on your bladder and prostate health. And but if you do all those things right and still have a problem, as 43 million men in America do, we're happy to help and to evaluate you. So let me jump into some questions because we've already got several. So you guys can submit questions. I'll go through these as try to get to all of them. But again, please follow up with us to sit down with one of our physicians and go through this. So this at the end, here's my contact info. You'll get this from a link that you'll receive after the presentation. Little QR code to meet me, schedule a visit. I do office visits here I'm here in Norwood in our office, also in our Fairfield office, but happy to do telehealth consults as well. So let me start with the first question. Urolift. Okay, this is so going back to that first treatment I discussed, the pins, the sutures that go on the prostate. So the gentleman here has a urolift procedure already scheduled. So he's gone through a lot of this process, met with a physician and has been offered this urolift procedure, is concerned about sexual function. So really important question. And the bottom line is minimal effect. I really never say never, no effect, absolutely no possibility you'll have an issue because we see all sorts of things. But this the studies on this, and it comes from a trial called the LIFT trial, very, very minimal sexual dysfunction, either in the form of erectile dysfunction or ejaculation problems. So that's one reason many men elect to have this treatment. Now, a couple things here. I'll get to the hopefully that answered the first patient's question. Now, IPSS quiz. So I went through some of those symptoms: urgency, frequency, I got to pee a lot. You can take this BPH score as we're going through these questions. Actually, I encourage you to take it. Take that score at your IP. It's called the prostate questionnaire, IPSS score. And if you're high on it, definitely come and see us. But this will help you better understand your own symptoms and hopefully emphasize to you the importance of seeing a urologist if you have a high score. So now let me go to the next question here while you guys are filling out that BPH score. So, okay, so my doctor told me my prostate is 50 something. So probably grams or milliliters. We'll talk about that. Never been on medication. Should I be on medication? The UroLift duration. There's a lot of stuff here. So there's a lot of background here. So I'm going to just kind of try to generalize this. But let me just say, so if you're told that you have a 50-gram prostate, what does that mean? Well, so a normal prostate's the size of a walnut. It's about like that. Okay. Now, what does normal mean? That's for a healthy 20-year-old male, 20-gram prostate. That's kind of how I think of it. So 50 is about twice or 2.5 times normal. That is enlarged, but there are many men who have prostates that are that large that have no symptoms or no problems whatsoever. So it's not just the size that influences this, but I would say that you do have an enlarged prostate. Okay. Now, medicines, again, we talked about lifestyle modification, the Men's Health 101 emphasis on what you need to do with your exercise, sleep, nutrition, but you don't necessarily have to go straight to surgery. You can try medicine. So this patient is, should I skip medicine, go straight to surgery? Maybe. This is, again, a nuanced discussion that we have in the office with patients, but a lot of times we'll do a medication trial. But again, some patients have side effects from these medicines, sexual side effects too. So a lot of men will go straight to surgical evaluation depending on their goals of care and what the side effect profile is for the medicines for them. Now, the duration, there's another question about duration. Is this permanent? So no treatment is necessarily perfect and permanent. We do have very good long-term outcomes, and most men don't need another procedure, but the UroLift data does show duration out to about 5 years and beyond that. But again, it depends on every patient's a little different on the size and shape of their prostate, and that will influence that outcome as well. So tissue growth. So this is the next question is just about prostate tissue growth. Again, I think I skipped over that part of the slide, but we're not exactly sure the mechanism of why the prostate gets bigger and how it gets bigger, but we do know it does. And again, 43 million men in the United States. So that growth, and you saw that anatomy picture, kind of looking back to the bladder and the prostate, there's not a lot of space in the pelvis. And so it's going to compress on the urethra and block the urinary flow. Okay, so how many patients have received, here we go. So a lot of interest in PAE. That's that last slide, prostatic arterial embolization. The question is, if you have serious symptom, or of course not, we don't want to delay any patient their care. So you don't have to wait for our center to open. We do have local practices. We work with almost every health system in the city and in Northern Kentucky. So we partner with local interventional radiologists and have some who have very good experience with this. So we do refer to local practices in the meantime, and that's done usually at the hospital or at an outpatient center. How many patients have received PAE? Well, many. I don't know. Again, it depends on what you're talking about here locally or nationally. This is, I think, a treatment that's really going to take off more and more. But we have good local experience and have partnered with a practice here who are really confident in with their local experience and outcomes and expect this experience to grow. But okay, so what kind of results summary should you expect? Okay, so this is a great question. Okay, so you have all these surgeries. We went through them rapid fire. What should I expect? Well, I would just go back to this questionnaire. 42 of you guys, actually a great majority of the audience has already filled out this BPH score. So what should you expect? You should expect those symptoms to get better. You should expect that IPSS score to get lower. So if you're peeing 8, 9, 10 times a day, we're hoping you pee 4, 5, 6 times a day. Nighttime is a really big problem, actually, and that's a complicated topic. Obstructive sleep apnea can affect that as well. There's other medical issues. But if you're peeing 5, 6, 7 times a night, very disruptive, we expect you after a treatment, if we're picking the right treatment and have a good outcome, to pee less than half of that. So maybe 1 or 2 times a night. So it's normal for men after the age of 50 to pee once a night, or after 70, 2 times a night. That's very normal. And so, we're looking for things that really disrupt your quality of life, your quality of sleep, and for that specific situation. But yeah, no, we want good outcomes in terms of better symptoms, but also avoiding those complications. So what I want for patients is no infections, no bleeding, no bladder stones, no kidney damage or bladder damage long-term. That's what we're trying to avoid. So have the UroLift. Okay, this is a good question. Another question about UroLifts, very specific. Do you have to remove those sutures? Yes, rarely. I've done it a couple of times for various reasons. Usually it's longer term. The procedure didn't work quite as well as the patient wanted, so we transitioned to a TURP or something else and remove those sutures. It's fairly straightforward to do that. Now, I like this question because this gentleman is really thinking, low-fat chocolate milk, is it good or bad? The short answer is don't really know. There's a lot of specific dietary advice you'll see out there. I try to keep it really simple, which is good fruits and vegetables. If you're looking for a diet to follow, there's Mediterranean diet is a really good place to start. What is that? It's fruits and vegetables, and avoiding the SAD. I call it the SAD diet. The standard American diet is very sad. So if you're eating the opposite of what most patients and people are in our society, you're probably doing well. But chocolate milk, everything in moderation. It's probably fine in moderation, but you can test that. You can see if you're drinking a lot of milk or chocolate milk and it's affecting your bladder, you may want to decrease that as part of your diet. How long will the PAE last? Can you repeat it? These are really specific questions. It is a durable treatment. It depends on what study you look at. But one thing about this particular treatment that we look at is patients who come in with a catheter. A great majority of those are doing well without a catheter many, many months after this procedure. So the durability, I think, is comparable to other procedures. And if any of these treatments generally can be repeated. So that's one question, I guess I would say, to really consult with our team, with our interventional radiologist, because again, just to make sure everybody understands, this isn't a procedure that I personally do. The arterial embolus PAE procedure, we've partnered with the interventional radiology team of doctors who do this. So very good question for them if you decide to evaluate that treatment. So this is a good question. So terms, I threw a ton of acronyms, a ton of terms out there. Ejaculatory dysfunction, what is that? So good question. And actually, this is kind of how I start one of the medication discussions. Flomax, we give this medicine all the time. And I tell patients, you're going to have retrograde ejaculation potentially. What does that mean? That means if you ejaculate, the semen actually won't come out. It will go backwards into your bladder. Now, that doesn't hurt you. It doesn't cause any pain. You won't even really notice it actually peeing it out. If you're trying to have a child, if you're a young man and concerned about fertility, it's obviously an issue. But this does bother some men. And so that would be a type of ejaculatory dysfunction. Premature ejaculation is another one. Sexual intercourse and ejaculating sooner than you would like. That's another type of ejaculatory dysfunction. But one of the side effects of some of these surgeries is you do lose that ejaculation ability. The semen will actually not go; it will go backwards into the bladder because the prostate again has both a urinary function, which we've talked about a lot tonight, and a sexual function. Okay, so another PAE question about sexual side effects. I would also say very minimal sexual side effects to that, similar to the UroLift. All right, so this patient, okay, this is a good, again, I want to kind of summarize and try to make it general, very specific patient questions. So I had a procedure, I had a UroLift, I'm not doing as well, several years down the road. What should I do next? Well, again, that's very specific to that patient. Particularly in this question was about bleeding risk, blood thinners. I have other medical issues. Definitely follow up with your doctor, your surgeon, to talk about that, because if you're not happy and if you're on other medicines and they're not working well, we can definitely offer you other procedures. And again, ones that can work well and can be safe and effective in patients who are on blood thinners. I mentioned the green light as an option. We talked about the PAE surgery as treatment as well. So there are other treatment options for patients who fail one of these. I wish we were 100%, but we are not. But again, I want to encourage you. We're talking a lot about sort of challenges and what happens if I have a setback in my health. I want to really emphasize that men do really well generally overall when they seek treatment. That can be with simple lifestyle changes, with medications, or with procedures. A great majority of men come in who see us with these bad urinary problems. They've been ignoring them for many years, and they get a treatment and are very happy from a quality of life standpoint. Okay, so this is a question. This is actually a really, really good question. So bladder issues are very complex, and this is one about prostate issues, not prostate issues per se, but urinary issues going back to childhood. So we see a lot of patients who have pediatric urologic issues who have transitioned into adulthood. There's many instances of daytime frequency of childhood, bladder issues, congenital abnormalities that have required surgery. So each of these is very, again, unique treatment approaches. And, even with patients who've had bladder surgeries or other surgeries in childhood, can you benefit from a prostate procedure? Potentially, it could be another problem, but these are patients that we usually are very careful and evaluate with other testing. I mentioned urodynamics. That's a test where we really test the bladder and its function. So patients who have complex issues that have lasted for their entire life, we'll usually do evaluation with the urodynamics test and involve a multidisciplinary team, other doctors in their care. So carbonated beverage, I love this. There's a lot of questions about it. And I really encourage you, if you're interested in this, again, it's really not much about prostate. Read that book, Outlive. I love it. It talks a lot about how to maintain your health and improve your health span. And then part of that, obviously, is your urinary health. But this is about very specific differences between clear drinks and dark drinks, 7-Up versus cola. Well, maybe not. I generally say stick with water as your primary source of fluid. You need your electrolytes, especially if you're exercising, you need to get your Gatorade or some form of electrolyte replacement. But all these beverages, if you enjoy something, that's fine. It can be a dark cola, a light cola, but just do it in moderation, I would say. Not sure which one's better, but do it in moderation. Physical therapy, great question. Is there physical therapy exactly for the enlarged prostate? I would say not exactly. Now, that said, pelvic floor problems, I see this is probably underappreciated and underdiagnosed. A lot of women have pelvic floor issues after childbirth, stress, incontinence, leakage, but men can have pelvic floor issues too for other reasons. And particularly, we see this a lot more in prostate cancer patients, radiation patients. But no, there are physical therapy exercises that you can do. Do they help with blockage and enlarged prostate? Not so much. But if you're having other urinary issues or pelvic floor issues, that can be helpful as an adjunct treatment. So this is a question about someone's had erectile function dysfunction treatment. Can I still get prostate treatment? Yes, absolutely. If you have a history of sexual issues or erectile dysfunction, then you have bladder problems or prostate problems, please come and see us, because we can definitely combine treatments there. And actually, a lot of times men will come in with an erectile dysfunction problem. Hey, doctor, and this, again, very common, very treatable. I'm having trouble getting an erection. And we find out later, oh, I'm also having trouble urinating, or the other way around. So we treat a lot of these men's health conditions, including erectile dysfunction, BPH, and you can treat both successfully. So this is great. If I go to bed at 10 or 11, when should I stop drinking fluids? Well, again, a lot of that's trial and error. A lot of it's going to be on what medicines you're on, how long you sleep. I'm really into this. This is my little sleep tracker. So I have a 8, 5, and 3-year-old, so I don't get as much sleep as I wish I could, because the kids are busy and keep us up at night sometimes. But no, sleep is really important. It's really critical. The more I've read and dug into this, the more I believe it affects your bladder health. So if you're going to bed at 10 or 11, there's not an exact time you should cut off fluid intake. You need to stay hydrated, but don't drink a big, huge glass of water right before you go to bed. I had one patient who came in, hey doc, I'm peeing all the time at night, and we go through and just do a dietary questionnaire. Well, we're drinking a whole bottle of wine at night right before I go to bed. Well, that's why you're peeing a lot. So let's work on that. But yeah, there's not an exact time. Trial and error with that. You can kind of see what works best for you. And if you want one of these little sleep trackers, they can be helpful to kind of see what really affects your sleep quality. So there's really cool technologies around this that might give you a really good answer to that question. Kidney stones. Okay. I love this question. This is also about drinking at night. Okay, so I have kidney stones. My doctor told me I have to drink a lot of water. That's true, to prevent kidney stones. But if I drink after 6 p.m., I'm peeing all night. How do I balance it out? Well, tough situation. Okay, and I would say that there's some other strategies besides just drinking a lot of water to help prevent kidney stones, including, depending on the type of stones that you've had, citric acid. This is, again, getting a little off topic, but I'll say it's a balance. And that's exactly what it is. How do I balance these things? Is, again, talking with your doctor, trying to find out when to stop drinking as much at night. But I'll tell you, for that patient, if you're having to really stay well hydrated for kidney stones and you're having a really bad problem with peeing in the middle of the night, well, that's a patient who should come in and see us and consider medicine or consider surgery for that urinary condition, because you got to drink water to prevent your kidney stones. So that's someone who should definitely come and see us. All right. So this patient this is a tough one. So again, patients who've had treatments that don't work. What's the cause? Impossible for me to answer that individual question. But what I'll say is there are plenty of treatment options, and sometimes it may not be the prostate. So if you've had a prostate surgery, you still have symptoms. Maybe it has to do with obstructive sleep apnea. Maybe it has to do with another medical condition. Maybe you're on Lasix. So this is a very common medicine where patients have to pee a lot, and they pee a lot at night because they have fluid overload problems related to their heart. So we work, again, with other doctors, with your primary care doctors, with your cardiologist if you have one, and can do more advanced testing of the bladder to try to find out what is the root cause. And again, patients who are really struggling, we kind of go back to the basics, start there with lifestyle modification, and explore treatment sort of one at a time to see what will work best. But yeah, it's a journey. And for some patients, they really struggle. And I have a handful of patients who have to have a catheter. I just did a surgery today on a patient who required a permanent catheter. It's called a suprapubic tube. So some patients require more advanced treatments and permanent catheters, and we'll work with you on that. And if you're in a category where you have really bothersome quality of life concerns related to your bladder, please come and see us, because we do have ways to make that better. Whole-up kidney function, this is a great question. So this is the one that, again, the orange peel surgery, again, appropriate for some patients who have a really large prostate. Can it affect kidney function? Well, usually I would say yes, in a good way, because if you have a really, really big prostate, I've seen them as big as 200 grams. It almost looks like a baby's head. If you're from the OBGYN world, the ultrasound, you can see a baby's head. It almost looks like a baby's head, that big. And so if you have a prostate that's really big, that can block the kidneys and can damage them. So usually procedures that remove a lot of tissue that can be obstructing the bladder or the kidneys are beneficial for kidney function. This is I'm glad I got this question. I'm going to go on a little bit of a tangent. Okay, so frequency of ejaculation, does this impact prostate health? The answer is yes. Now, I remember this study as well as any I reviewed in residency. So in residency, I did my residency in Nashville, Tennessee, and we would do journal club. We called it journal club. We would look at studies in the literature, and one that was quite interesting is out of Europe, and it looked at ejaculation frequency in prostate cancer. And this is a real study published in European Urology, I think was the journal. And what it showed is that the frequency of ejaculation decreased your prostate cancer risk. And they had like I don't know how they got guys to do this and report this, but they had a lot of men who had different frequency of ejaculation. And the bottom line is the more frequently you ejaculated, the lower your prostate cancer risk is. Now, I tell you that there's a lot of details in that study. And so do with that what you may, but no, I mean, I think, healthy sexual life is good for your overall health. And so if you're having sexual concerns, please come and see us as well, because we can help you with that. Okay. So this is a good, I like this. So PAE seems like a no-brainer. Well, every time we offer a new treatment, a lot of times that does seem true. It's, we believe in this treatment. That's why we're partnering with this practice and building this new center. We're really excited about it. We think it's a great treatment, but it's not for everybody. And so there are some conditions because you have to use contrast. If you have bad kidneys, that can be a reason not to do it. There are other reasons not to do this treatment. And what I'd say is, rather than go through the laundry list of all the contraindications, because there are a lot of them, that means contraindications just means reasons that you wouldn't benefit from this surgery. You can't have this surgery. We counsel every patient for every surgery sit down in the office, and our interventional radiology colleagues would, to say, are you a good candidate for this? So there are some reasons. Renal function would be one, a few other concerns. But what I would tell patients is, I'm happy to go through that entire list, all the guideline supported, evidence-based, medicine supported treatments we're happy to discuss and offer to patients. And our group offers all of them. And so we're really, again, want to sit down, ask you about your symptoms, focus on quality of life concerns, go through those men's health 101 topics with you, make sure we're getting those things right, talk about lifestyle changes, talk about medicine options, other health conditions, and then surgical treatment. And we'll go through all the ones that can be appropriate for you based on your individual story and your individual anatomy. So that's actually a great way to end. Hopefully, I really, really appreciate you guys, your time, and investing in your health in this way. I love doing these. I'm in the office here by myself, but I really appreciate you guys logging on and appreciate this interaction with the questions. Please, there's a way to connect with me online, but I really have many great partners. All my partners are great, and they will take good care of you. I've had them treat family members of mine. So please reach out to our practice. We're happy to see you, happy to care for you, happy to answer your questions. So again, thank you so much for your time. We really appreciate it. And we hope you reach out to us to schedule an appointment. All right, take care.